All right, we're going there. We're talking about hemorrhoids. Yeah, I know, not the most glamorous topic. But let's be real. If you clicked on this video, there's a good chance you or someone you know is dealing with them. And honestly, that's nothing to be embarrassed about. Hemorrhoids are super common, like really common. It is estimated that about 1 in 2 adults will deal with them at some point in their lives. So if you're experiencing discomfort, pain, itching, or, yep, even some blood when you go to the bathroom, you're not alone. Let's break it down. What are hemorrhoids exactly? Well, hemorrhoids are basically swollen veins in your lower rectum or anus. Think of them like varicose veins, but in a really unfortunate place. There are 2 main types: internal hemorrhoids, which are inside the rectum, and external hemorrhoids, which are under the skin around the anus. Internal ones usually don't hurt, but they can cause bleeding when you go number 2. External hemorrhoids, on the other hand, can be painful, itchy, and sometimes form a hard lump if a blood clot forms. That's called a thrombosed hemorrhoid. And yeah, it's about as fun as it sounds. So what causes them? In short, pressure. When there's too much pressure on the veins in that area, they can swell up and become hemorrhoids. Some common triggers include straining during bowel movements, pushing too hard, chronic constipation or diarrhea, sitting on the toilet too long, scrolling TikTok in there for 20 minutes, not ideal, pregnancy, especially later stages, heavy lifting, obesity, and even just aging, as tissues weaken over time. Now the symptoms depend on the type and severity. Some people just get a little itchiness. Others deal with full-on pain, swelling, or bleeding. If you notice bright red blood on toilet paper or in the bowl, that's a classic hemorrhoid sign. But, and this is important, any rectal bleeding should be checked out by a doctor, especially if it's a new thing for you. Don't just assume it's hemorrhoids. So, what can you do about it? Good news. Most hemorrhoids go away on their own or can be treated at home. Here are some simple things that help. More fiber in your diet. Fruits, vegetables, whole grains. You want soft, regular stools. Drink more water. Dehydration leads to harder stools, which leads to straining. Don't strain on the toilet. No pushing like you're trying to launch a rocket. Don't sit too long. If you're done, get up. The toilet is not a throne. Warm sitz baths. That means soaking your bottom in warm water for 10-15 minutes. Total relief. Over-the-counter creams or wipes. These can reduce itching and swelling. Still here? If this video has been helpful so far, even just to make you feel a little more normal, hit that like button. It helps a lot. And if you want more honest, clear health info like this, consider subscribing. No shame, no fluff. Just real talk. All right, let's continue. Now sometimes hemorrhoids get worse or they don't go away. If that happens, doctors have a few more options. Some are pretty simple. Rubber band ligation. They place a small band around the hemorrhoid to cut off blood flow. It shrivels and falls off. Sclerotherapy. They inject a chemical to shrink the vein. Infrared coagulation. A laser or heat device is used to shrink it. And in more severe cases, there's surgery, called a hemorrhoidectomy. That's when the hemorrhoid is fully removed. It's effective, but recovery can be painful, so it's usually a last resort. Now, let's talk prevention, because once you've had hemorrhoids, you probably don't want them again. Here's how to reduce your risk. Eat 25 to 30 grams of fiber per day. Stay hydrated. Exercise regularly. Don't delay when you need to go. Holding it in is bad news. Avoid prolonged sitting, especially on hard surfaces. Basically, treat your body and your bathroom habits with some respect. Your backside will thank you. And one final note. If your symptoms don't go away or you're dealing with a lot of pain, swelling, or bleeding, see a doctor. Don't let embarrassment get in the way of getting help. Doctors see this kind of thing every single day. Literally. It's no big deal to them, and they can help you feel better faster. So yeah, hemorrhoids suck, but they're common, they're treatable, and they don't mean something is seriously wrong with you. You're human. Your body does weird things sometimes, and with a few small changes, you can get back to normal. Thanks for watching. If this video gave you some relief, physical or emotional, hit the like button. And subscribe if you want more simple, stigma-free health videos like this one. See you in the next one.